Hello, and thank you for your time today. I'm Sara Pauk, and I'll be presenting this virtual poster entitled Vaginitis 101, an online self-directed vulvovaginized curriculum for the OBGYN resident. My co-authors are Dr. Linda Eckert and Dr. David Eschenbach. The objective of our project is to improve patient care by creating a set of online modules to enhance practical knowledge of vulvovaginal conditions among resident physicians at an OBGYN residency program. As a recent residency graduate myself, it was important to me that the modules be short and easily digestible, be accessible anywhere, including from a mobile phone, provide practical information for use with patients, and not add significantly to the already heavy resident workload. We begin the project by assessing the resident educational needs with informal interviews with residents. This led to the development of 11 modules, each containing a PowerPoint lecture that lasted about 20 minutes, a one-page PDF quick reference, and a post-module quiz created using the Interact platform. Interviewed residents also identified a need for clinical tools to assist with the assessment, examination, and management of patients with complex vulvovaginal conditions. So a website was created using Weebly for Education that integrated the modules and clinical tools. Finally, after creation of the modules on the website, all materials were reviewed by senior faculty with expertise in the field, and then trialed by current residents for ease of use. For my results section, I'm going to give a brief tour of the website and modules. Of note, this website is formatted for use on both desktop and mobile phones, and the appearance of the site changes depending on which device you are accessing it from. This top section contains the aforementioned modules, and I will return to it shortly. As we scroll down, we come to the clinical tools. Our clinics all use Epic, so templates are formatted for this EMR. The Epic template subsection contains HPI, physical exam, and procedure templates relevant to our clinic. The remainder of this section includes University of Washington specific patient handouts, as well as medication dosing and prescribing for commonly and less commonly prescribed medications in our clinic. The next section includes a selection of helpful videos of testing and procedures relevant to the care for this patient population. Of note, they are all from YouTube but are embedded to play directly on this website. They have been queued to start at the point in the video that is most relevant to the curriculum. All videos have been credited. Finally, these modules are by no means comprehensive, so this section contains a list of outside resources with further education and patient care tools that have been put together by experts in the field, experts that I have learned a lot from while developing this curriculum, and I hope the residents will too. And then returning to the modules, let's take a look at an example. So each module contains a list of objectives. There is also a quick reference PDF that is exactly one page that should contain all the information that someone would need to know to diagnose and treat a patient with this condition in clinic. It can also be used as a study aid if printed. There's a set of lecture slides that I will not open right now, and then a post-module quiz. Of note, the quiz will give you immediate feedback, so if you, for example, select the wrong answer, it tells you that you selected the wrong answer, what your answer was, as well as what the correct answer was. I won't go through the full quiz at this time. Further down, there's a list of resources and articles for further study. Of note, the website is password protected, so we are able to provide direct links to the PDFs of these articles through our library system. And then finally, there are PDFs of the University of Washington handouts, as well as links to outside handouts, and then, if relevant, patient support sites. Future directions for this project include full integration of the modules into the residency curriculum, as well as introduction of the clinical tools to resident clinics, assessment of resident comfort with and knowledge of complex vulvovaginal conditions before and after introduction of the curriculum, and audio recordings of each lecture to allow residents a choice of preferred learning media. I'd like to thank everyone who helped make this endeavor possible, specifically the Edward Prince Fund, which generously provided support for this project, as well as Drs. Eckert and Eschenbach, who shared their insight, knowledge, and guided me through this process with patience and wisdom. And finally, thank you so much for your time and attention. If you have any questions, comments, or suggestions, please send them to me at the email address listed below. Thank you and have a good day.